Hello, I'm Dr. Frank Barone, a board-certified plastic surgeon. And the issue of board certification is often a confusing one for patients. As the number of choices for patients has grown in cosmetic surgery and aesthetic services, injectables, medical skincare, so has the confusion and options for patients. We often see the term board certified or doubly board certified advertised for certain physicians, marketing aesthetic or cosmetic procedures. But surprisingly, most patients don't realize that the board certification they're advertising isn't actually in the specialty of the service they're providing. It's in an unrelated specialty. So it can be confusing, and this lack of transparency has created some real problems. The state of Florida, for example, has enacted legislation requiring physicians to advertise board certification to specify exactly what specialty that certification was obtained, because it needs to be related to the service they're providing, not to some unrelated specialty. Board certification matters because originally board certification was established by the American Board of Medical Specialties to improve safety for patients and verify the credentialing and training of a service provider, a physician. And if they completed certain rigorous qualifications and experience, then they would obtain board certification in that specialty, such as in surgery, or in dermatology, or in plastic surgery, or in pediatrics. Unfortunately, though, it's legal for some doctors to come up with other boards that aren't related to the American specialty boards. And these can be obtained by anybody, and consequently you can announce yourself or say you're board certified in cosmetic surgery, for example. Well, there is no official board of cosmetic surgery, but it can be advertised as such. So again, patients are confused because even though there is no board of cosmetic surgery, they say, I went to a board certified cosmetic surgeon. Well, such a thing doesn't actually exist. So it's very important that patients learn a little bit about this process, because the choices they make in aesthetic surgery can have lifelong implications. And I think it's critical and ethical for doctors to be board certified in the specialty that they're going to be doing on a patient and not in an unrelated specialty. The questions that should be asked is, first and foremost, what actual specialty is the physician certified in? Is it one of the 19 recognized specialties by the American Board of Medical Specialties, or is it in a self-anointed type of a board that anyone can make? Secondly, what is the experience of the physician or service provider? Are the nurses providing injectables or other services? Are they licensed and registered nurses? How much experience do they have? Ask about your skincare provider. Are they licensed estheticians? Have they been trained appropriately, or do they just take a course? So we want to make sure they've completed credentialed training in their specialty. And finally, and most importantly, I think it's important for the patient to check into these qualifications and be sure that the doctor doing the procedures is board certified in a related specialty, such as plastic surgery or dermatology. This relates to safety, this relates to results, and I think it's important for the integrity of our specialty that we be transparent with patients because they will trust us, and they need to trust us if we're providing services.